At the risk of asking for a generalization, are there any non-Western cultures that seem to have, I don't know, traditional or significant proactive and positive supports for people with autism on the spectrum that kind of stand out in your mind?
I'm not sure if you're asking about a general, I mean, I certainly know of examples that I've been very impressed with. So I think there's sort of like this stereotypical way of thinking that where you have money, people are doing better, and where you don't have money, people are not doing so good. And maybe that's, as a generalization, in part true, but certainly I've been around communities and colleagues, very much like Deborah and probably half of the parents in this audience, who've taken it upon themselves to create that level of services and support, so very much, you know, universally there. And I think in cultures, or let's say in places, I'm not sure if it's primarily explained by culture. So, for example, in the Palestinian West Bank, I've seen some of the most beautiful supports for families with autism, because this is a community that has lived its entire life under extremely difficult political circumstances, lots of barriers to transport, lots of issues in medical care. And over time, people developed these alternative ways of delivering care in using this community-based rehabilitation approach, is what they call it. Really well studied, really good. And you see the results of that in the types of autism services that they have. So just to give you an example relevant to this morning's discussion, so the center that we worked with and to develop engagement with research and to support infrastructure, basically, you know, some of the families that they serve come from very small villages. And as part of, you know, the kind of full-fledged diagnosis that they do, something that we don't do in our center, but they care about very deeply, is that they actually will send a member of staff back to the village with the family to talk to the elders, to talk to the school teacher, to rally support for this child, literally rally support for this child, so that any you know, if a child picks on them or if their teacher is being cruel to them, that those people are themselves stigmatized for doing that. Right? Which I think is very cool, as a kind of like your flip side of however you're stigmatizing the bully by saying we're a connected community and we should be supporting this individual. So you kind of bring that community connectedness to the service of the kids themselves. So I think that sort of probably applies more in places where resources are more limited, because you know you have to just rely on alternative ways as opposed to kind of a more formal service delivery that comes from government or something like that. So I don't know if that answers your question, but sort of certainly really inspiring examples in my life.
I have a mic. Thank you for coming. That was a great talk. I'm interested in the stuff about a navigator, the family navigator. I'm interested just to ask a little bit more about, you know, training a family navigator. You see that there are important points of transition. Are you finding any differences with different cultures, with different populations, in terms of what a navigator should look like?
Mm-hmm. Yeah, excellent question. So I'll just answer the broader question of who is a navigator, and then attempt your actual question. So a navigator, in our definition, isn't sort of limited by what field they trained in. So we equally benefit from people who have a psychology background, a social work background, sometimes PT/OT. So anybody who, you know, from a broader allied health category. We've specifically defined it as somebody who shouldn't and can't have a very specialized, you know, degree, either medical or allied health, because that sort of defeats the purpose. Navigators are meant to be frontline workers, right? So, and for them to be able to eventually serve at population level, we need to be able to place navigators in primary care, which means that they can't be at the other extreme of specialization, right? A navigator benefits from skills like empathy, good communication, you know, just your sort of classic ideas of what a good social worker would look like, but then would essentially have a twofold goal. One is a clinical one with the family and the caregiver, and the second one is more what we define traditionally as a case manager. So the person who shuffles papers and makes sure that the papers get to where they need to be. So they just combine those two. Another dimension that I'm not sure fits in navigation, but this is the conversation that we're having, is that the World Health Organization just released a manual for what they call a parent support training program. And there's field trials that are beginning to emerge about this in lots of places in the world. We've been funded by Autism Speaks to do sort of a local adaptation of that model as well. And unlike our navigation model, that very much is meant to be focusing on parent-child interaction, increasing child engagement and communication. So we see them as complementary. What we haven't answered yet is there room in the navigator schedule to fit that additional parent-child interaction, which goes more in the direction of what I associate with treatment, like autism treatment, and I'm not sure we're at the stage where we've done enough work with the community to know whether those are two separate things or if they can be packaged under the whole navigation umbrella. Only yesterday, just before I left the airport, we had a community meeting where there's a lot of really excellent discussion about something like, well, this model can definitely benefit people from First Nations, right? Northern Quebec, our hospital is actually responsible for delivering certain services. There's a kind of a mandate of medical care for some communities in Northern Quebec. And people were very skeptical that I can send a navigator, or that I should even think about sending a navigator without that navigator being sort of a concept that's developed with the community itself and essentially with the local knowledge that they would need. So I think it's an excellent question that I don't have a kind of a pure answer for, but I think it can be on a continuum. I think it's very different to say, in Montreal, we serve a hugely diverse population in terms of ethnicity and cultural background and SES. I'm not sure that we need extremely specific provisions to deal with that. However, if we're talking about marginalized communities where there's distrust of the public health system, that's where I think we need a whole different way of thinking about the problem, right? I don't think sort of an all or none, but I think we need to sort of push forward with at least a more generalizable one. I don't know who mentioned there's the idea of concordance, the concordance between the clinician and the so basically, obviously one of a good step forward in our health services is to just have more diversity of the people delivering care to match that population. I love that idea, but I'm also very skeptical that it's very practical. So the last count that we did of the ethnic categories that are served by our hospital exceeds something like 20 ethnic categories. So does that mean that we have kind of a level at somewhere that matches your ethnic background with the ethnic background of the patient that you're going to see or the family that you're going to see? I'm not sure I like that idea very much. I think it's more the question of some of the examples that I gave you, those sort of like the thinking differently about the diagnostic process. We sort of realized as a team that the Montreal Children's Hospital Diagnostic Center has, over the past 10 years, developed a lot of capacity in dealing with that diverse population that we didn't even know we had, because nobody sort of took a step back and said, how are you tailoring your practice to fit the needs of these populations? But even the clinicians themselves say, I still feel very, very challenged by having to serve an Aboriginal community, and I do want to learn more about it, right? And I think those are the good ways for us to sort of decide whether that sort of service provision needs to be very specific versus generalizable.